Thank you, Paula. So thank you for the invitation to speak to you today. Tanya and I are very happy to be here to share with you some information about physical activity and exercise after transplant. So today what we're going to cover, we're going to tell you a little bit about our network called Can Restore. We're going to be describing physical challenges that transplant patients and organ donors face before and after transplant, and then discuss the role of exercise for organ donors, discuss the role of exercise on physical function and quality of life before and after transplant, and then provide you with some tips for engaging in exercise and physical activity. So first I want to introduce a network called Can Restore. It's the Canadian Network for Rehabilitation and Exercise for Solid Organ Transplant Optimal Recovery. Tanya and I co-chair this network, and we have a 9-member steering committee, which includes transplant clinicians, researchers, as well as patient partners. And our mission is to achieve optimal health and well-being for transplant candidates and recipients through physical fitness and rehab. So you can visit our website, canrestore.ca, and there's a number of resources there for yourselves to learn more about exercise and physical activity. So a little bit about what we do as Can Restore. One thing is that we synthesize the best evidence, the best research evidence about exercise and physical activity. And one recent example of this is that we published in a peer-reviewed medical journal a position statement that discussed the recommendations for exercise for solid organ transplant candidates and recipients. And on our website, you can find the full paper, you can find a summary, and we also have developed some infographics that make it easier to read that tell you what are the recommendations for exercise before and after transplant. And Tanya will be talking a little bit more about this later in the presentation. Another thing we do is we hold events for transplant candidates, recipients, donors, and families to learn about exercise, to learn about healthy lifestyle, and also to practice some exercise as well. So a few years ago, we did one called Ready, Set, Go that helped prepare people that were going to the Canadian Transplant Games. It was open to everyone, kids and adults, donors and families, to learn about exercise. We did some educational seminars, and we also did some in-person physical training. We also partnered with the World Transplant Game Federation and the Canadian Transplant Association to help launch the Fit for Life movement. So this is a movement through the World Transplant Games Federation to get more people active after transplant. So we hold these sorts of events, and they're advertised on our website and through social media, so you can keep an eye out for those. Also on our website, you'll find exercise, frequently asked questions, exercise tips, and even some videos on how to exercise. So you can click on different links on our website, learning more about exercise and physical activity, how exercise can help you, frequently asked questions. These are all from our website. And then you'll get some more specific information about how to get started on exercise program and some of the common questions that transplant recipients and candidates have about physical activity and exercise. So please do check out our website. You'll find a lot of answers to some of your questions there. So now I'm going to move on to talking about physical fitness before and after transplant and donation. So first, what is physical fitness? So there's basically 2 major components of physical fitness. One is aerobic fitness, which is the fitness of our cardiovascular system. That's our heart, vessels, and the oxygen capacity of our muscles. So aerobic fitness really tells us about the body's ability to use oxygen for energy. You might hear a more technical term called VO2 max, and that's kind of, athletes get their VO2 max tested. You may have even gotten your VO2 max tested if you attended a rehabilitation program. And this is our best measure of aerobic capacity, but we also use things like walking tests to get an idea of what somebody's aerobic capacity is. The second major component is musculoskeletal fitness, and that refers to muscle strength, muscle endurance, as well as flexibility. And I'll be touching on why these 2 components are very important before and after transplant. So in terms of aerobic capacity, this is a major predictor of your overall health, and this is across all people. So people with a greater aerobic capacity do have better cardiovascular health, reduced morbidity, and mortality. So this, as I mentioned, it's across people who have no comorbidities, no conditions. It also holds true in people with transplant. We think, we do know cardiovascular health is better in people who have had a transplant that have a greater aerobic capacity. But more specifically in kidney and liver transplant recipients and candidates, people with a greater aerobic capacity have lower waitless mortality, They have better graft function post-transplant, and they also have better post-transplant survival. So this just adds to the very important component of improving and maintaining aerobic capacity before and after the transplant. In people who are donors, this is also important if you're going to be in the hospital or undergo any type of surgery. So people who have a greater aerobic capacity will have a reduced hospital length of stay after their surgery, and they're less likely to need more intensive rehabilitation, so an inpatient rehab stay. The second component, musculoskeletal fitness, I showed you a variety of measures: muscle strength, muscle endurance, and flexibility. But muscle strength seems to be the most important predictor of sort of our clinical outcomes. So muscle strength is associated with all types of exercises. So your ability to walk and to do other exercises is dependent on your muscle strength. It's also very important for daily tasks, such as standing up from a chair or climbing stairs. So some of you may have even experienced a reduction in muscle strength after being in the hospital, after donation, or after transplantation, where your muscles do get weaker because you're being in bed, you're not very active, and you may have had trouble standing up from a chair or going up a flight of stairs, and you may have really felt it in your thigh muscles. So in kidney and liver transplant recipients specifically, muscle size or muscle mass is associated with some important clinical outcomes. One is hospital length of stay. So people who have a lower muscle mass tend to have a longer hospital length of stay. It's also associated with post-transplant survival and graft function. So again, those with lower muscle mass tend to have lower survival rates and poorer graft function. So why is exercise limited before and after a transplant? So I'll start by talking about before transplant. So there's a number of pre-transplant factors that can affect your exercise capacity. One of the major factors is the reduced level of physical activity that occurs over time as you're waiting for transplant, as your actual primary disease may be worsening. So overall, you're probably engaging in less physical activity, the body systems become deconditioned, so both the muscles, the cardiovascular system, people tend to feel more fatigued and they engage in less physical activity overall. Specifically, if you have liver disease waiting for transplant, the liver is a major source of glucose, and muscle uses glucose as its main supply for energy. So when that liver isn't functioning properly, the release and uptake of glucose is altered. So the muscles might feel weaker and more tired because their energy supply is not functioning typically. The muscles of people with liver disease also tend to get smaller, so it's called muscle atrophy, and they tend to get fatty infiltration, which means the muscle tissue is being replaced by fat, and that results in the muscle becoming weaker as well. In kidney disease, there can be vascular issues, so less oxygen-rich blood is being delivered to the muscles. Again, you'll feel this as muscle fatigue. It can be associated with bone disease like osteopenia or osteoporosis. And again, people with chronic kidney disease experience muscle atrophy and muscle weakness, very similar to people with chronic liver conditions or cirrhosis. How about after the transplant? So you would think now that the organ has been replaced, that primary condition is gone, exercise should return to normal capacity or what we would expect. But it's found that aerobic capacity, or VO2 max, is typically only about 40 to 60% of predicted in the majority of solid organ transplant recipients. So this is across liver, kidney, lung, and heart. And so what are the factors leading to that? So again, deconditioning is a major factor. So all body systems are going to be affected by deconditioning. This can be carried over from the pre-transplant condition. So because with a worsening disease, you may not have been engaging in physical activity, you're in this deconditioned state. So that continues post-transplant unless you start on an exercise program and start improving it. As well, the effects of immunosuppressant medications tends to be playing a major role. So we know some of the side effects of immunosuppressants are muscle weakness and loss of muscle mass. It also impacts muscle endurance. So it actually alters the muscle's ability to use oxygen, so the muscles feel more tired. And also with immunosuppressant medications, there's a risk of having high blood pressure, glucose intolerance or diabetes, weight gain, or an osteoporosis. So these can all affect your exercise capacity. But with training, exercise capacity can be increased despite the fact that you're taking immunosuppressants. And how about donors? So why is exercise limited after hospitalization? So going into the donation, you may have had a very good physical function, which of course would help you to recover quicker after surgery. But due to the surgery itself and to hospitalization, you might also experience deconditioning because during that period of hospitalization, you're going to be undergoing low physical activity levels. It's going to take you some time to recover. So again, all body systems are going to respond to that by becoming the muscles becoming weaker, the cardiovascular system becoming deconditioned. You can also experience muscle weakness due to the surgical incision and musculoskeletal pain. So in terms of muscle weakness, I just wanted to touch on what muscles are actually cut, especially with the liver transplant, but you may also experience from kidney transplant as well. So if you look at the muscles of the abdominal wall, there's actually 4 layers of muscles. And this top one, the rectus abdominis, is the one that people think of most prominently because that's your 6-pack abs. You can see that it's divided by these tendons, so it comes out in these pockets. So that's the very top muscle, but underneath there's other muscles as well. There's this transversus muscle that helps stabilize, and there are these oblique muscles that the fibers go one direction and the other direction. So when you get the surgery, these muscles are cut through and it's completely disrupted. The muscle is going to take time to heal, and it may not even heal in a healthy way. It may actually be replaced by fibrous tissue or fatty tissue. So it's not even necessarily being replaced by muscle tissue unless it's in the right environment. And that environment is movement and exercise. So that weakness can persist for years after surgery, and you may not feel like your abdominal muscles are coming back. So abdominal muscles, we know they're the core muscles of the body. So their main function is to help flex the trunk or flex your body and rotate the trunk. But it also has a really important role in stabilizing your posture. So if you have weak abdominal muscles, it can lead to low back pain. It can lead to pelvic floor dysfunction. So things like incontinence, urinary incontinence, for example, because the abdominal muscles, they also help support the pelvic floor. And the abdominal muscles also have a role in breathing. So especially when you're breathing out forcefully, like when you're exercising and you need to really breathe heavy, those abdominal muscles play a role. But having stability of your abdominal muscles also plays a role when you're breathing in. So your muscles, when you're breathing in, your diaphragm needs to come down and your abdominal muscles need to support that. So the abdominal muscles are a very important muscle group. And when they're disrupted, it can affect a number of different body systems. So I'm now going to pass it over to Tanya to talk about physical activity.
All right. Okay, so hi everyone. Before we start talking about the role of exercise, I just would like to go through some definitions that I think will be important for you to know, and so you understand the recommendations that we will give you at the end of this presentation. So what is physical activity? It's any body movement of your body, any movement of your body that results in the use of energy. Some examples are walking, household activities, gardening, climbing stairs, leisure sports, etc. And what is exercise? You will be hearing me talking about physical activity, exercise. So exercise is a type of physical activity that consists of a planned, structured, and repetitive bodily movement that is done to develop and or maintain physical fitness. And it's usually there's a dedicated time with the purpose of improving your strength, flexibility, and or endurance. So your physical fitness that Sunita has talked about. And some examples are walking, cycling, aquafit, jogging, yoga, weightlifting, stretching, etc. So there are different types of exercise. So what are strengthening and resistance exercise? You will be hearing me talking about this. So it's any exercise that makes your muscles work harder than usual. And it can involve using your body weight or working against a resistance. So you can see here in the pictures, you can use elastic bands or dumbbells, or you can even use your body weight. And what is aerobic or cardio exercise? It's exercise that uses large muscles continuously for a prolonged period of time, and that makes your breathing and heart rate increase. And some examples are walking, jogging, dancing, and swimming. So now let's talk about the importance of exercise. Why is exercise important? So there is strong research evidence showing that exercise improves heart function, improves blood pressure, increases muscle mass and strength, has a role on weight management, improves blood sugar control, increases energy levels, improves sleep quantity and quality, and reduces anxiety and depression in healthy individuals and those with chronic disease. So there is a strong research evidence showing all these incredible benefits. And what about the importance of exercise for living donors, transplant candidates, and recipients? So should living donor candidates be physically fit before donation? The answer is yes. And if you are a donor candidate, or if you have donated already, you may have noticed that the doctors or the healthcare team wants to evaluate your physical health. And in general, living donors should be physically fit, in good health, and should not have or have had diabetes, cancer, high blood pressure, heart disease, or other conditions. And if you look at this diagram here, you can see how physical inactivity interacts with all the organ body systems, and how physical inactivity is a strong risk factor for many chronic disease. Here we have a list of 35 chronic disease, and some of them are the disease that you are not supposed to have if you want to be a donor. So if you are physically active, you will be less likely to have this disease here that you're not supposed to have. So what are the goals of exercise for organ donors? So in general, donors are healthy. So the goals are to increase general mobility after surgery while in hospital. As Sunita said, this is very important because you lose your mobility and you may lose your physical fitness a little bit while you're there. Another goal is to help regain function after leaving the hospital and return to work as well as to your family and societal roles, and of course to help maintain physical and mental health after donation. So here are some recommendations of exercise post-kidney and liver donation. So first of all, again, early mobilization. I will be talking a little bit more about the benefits of early mobilization in a minute, but early mobilization while in hospital to regain function, it's very important, and you should be doing this as soon as possible. If you have been in hospital already, or if you will be, you will see that the physiotherapist will be asking you to sit, to stand, and to walk as soon as possible after the surgery. Healthcare professionals will ask you to avoid heavy lifting for about 6 weeks after the surgery, but talk to your healthcare professionals because there may be some differences in this time frame, depending on the type of incision that you had and your medical history. As Sunita mentioned, your muscles are cut. So especially for liver donors, abdominal and pelvic floor exercises are recommended, and they can start about 2 weeks after surgery. You start with the mobility before, but specific exercise for abdominal pelvic floor muscles, you can start after 2 weeks. And those exercises help strengthen your deep abdominal and pelvic floor muscles and will enhance blood flow to the incision area and promote healing. So here we have some pictures of some examples of exercise that you can be doing. These are very, I would say, basic exercises that you can start 2 weeks after. Of course, then you can progress to more advanced exercise. Just to give you some examples, this is the belly button exercise. So you basically lie on the floor or on a mat and you flex your knees, you put your hands under your back, low back, and you tighten your muscles, your abdominal muscles, and you try to bring your belly button towards the ground. And you keep it there, tighten the muscles for about 3 seconds, and you can do some repetitions of this exercising according to what your physios will be asking you to do. Here it's a similar exercise, but you do a pelvic tilting, and again you tighten the muscles and you try to bring the belly button against the floor. Here, the knee rolling exercise, it's a similar exercise. You flex your knees, you tighten the muscles, and then you start moving the knees from one side to the other while tightening the muscles. And here are some simple examples of pelvic floor exercise that you can be doing. As Sunita said, those can be compromised because abdominal muscles help with the support of the pelvic floor. So this is very simple. You basically elevate, you flex your knees and you elevate your hip and you stay there for some seconds, 3 to 5 seconds, and then you go back and you do some repetitions. Usually you can do 10 repetitions, 3 sets of 10 repetitions for all this exercise. And the last one is this one here. I think it's simple to understand. You move your arm, alternate arms and legs, while also tightening the muscles, the pelvic muscles and the abdominal muscles. More recommendations of exercise post-kidney and liver donation. So again, you should return to normal activities, including physical activities or exercise, to maintain a good physical and mental health. Usually for kidney donors, it's about 4 to 6 weeks after donation that you can start going back to your normal activities. And for liver donors, a little bit longer, 2 to 3 months after donation. But again, talk to your healthcare team and see, depending on what type of donation you did or incision in your medical history, this time frame may change a little bit. For kidney donors, and some of you may have heard about it, actually came out as a question as well, I think in the platform that Paul is using, is that healthcare professionals ask you to avoid contact sports like football, boxing, hockey, soccer, and martial arts. Again, speak to your healthcare professional. The rationale here is because if you donated one kidney, you only have one. So you need to be careful not to lose this one because of damage, of trauma or anything. But again, it's not that it's prohibited, but you should avoid, but again, talk to your healthcare provider to get some more information there. So now we're going to move to goals of exercise before transplant, so in transplant candidates. So the goals are to optimize physical fitness prior to transplant, so we can make those patients stronger to endure the stressor of this big surgery. We also aim to improve waitlist survival and quality of life. Of course, there's very limited evidence that we can actually improve survival while on the waiting list. But as Sunita said, reduced aerobic capacity is strongly correlated with early death during a waiting list period. So this is definitely one goal that we should have. But of course, more studies will need to be done to prove that we can do this. Another goal is to improve early post-transplant outcomes. For example, we want patients to have shorter hospital length of stay after transplant and better functional independence at hospital discharge, so they can be very independent when they go home. And we think that perhaps doing these exercises before transplant, we can influence recovery post-transplant. So what is the evidence for exercise interventions before transplant in solid organ transplant candidates? So this is a review that my research team completed this year and published earlier this year. We found 23 articles in total that looked at the effects of exercise interventions pre-transplant. Only 4 articles were in liver candidates and 2 in kidney. And what we found was that in general, this type of intervention was acceptable to patients. It was safe, which is really good. We saw some effects on exercise capacity and quality of life. And only 2 studies looked at the effects of exercise on post-transplant outcomes. So, and these studies they found that there is some decrease in days in hospital. So patients who exercise pre-transplant, they spent less days in hospital compared to other study or other patients who had not done exercise. And what we found as well was that unfortunately there was insufficient evidence to provide specific guidelines on the dose of exercise. For example, how frequent you should exercise, with the intensity of exercise type and time, or program duration. So there is limited evidence for us to give specific recommendations. However, Sunita and I had the opportunity to co-chair a working group recently, and to develop a position statement on exercise for solid organ transplant candidates and recipients. This was a partnership with the Canadian Society of Transplantation and Can Restore. And this group, with the opinion of this group, who are expert in exercise and transplantation, we were able to put together some recommendations for you. So here, sorry, this is an infographic showing the recommendations of exercise pre-transplant, also after transplant, that I will show you later. So here are the recommendations. I'm listed for a transplant. Can I exercise? Yes, of course you can. And you should be doing walking or other cardio-based exercise along with strength exercise. And these exercises are safe. Here we have some examples of exercise that you could be doing. And we recommend that in this phase, exercise should be supervised and conducted in a hospital or rehabilitation hospital or your transplant center, or perhaps at home. There is some evidence showing that exercising at home pre-transplant is safe, but we need more studies to be sure. So then you beat the odds and you received a kidney or a liver transplant. So how does the road to recovery look like? So again, talking about early mobilization, you should start doing early mobilization in hospital. And there is studies showing that early mobilization in hospital improves respiratory function, reduces adverse effects of immobility, for example, loss of muscle mass that Sunita talked about earlier, increases level of consciousness, increases functional independence, increases cardiovascular fitness, increases psychological well-being, and reduces the risk for delirium. So it's very important that you start moving, and this is also relevant for donors, that you start moving as soon as possible. Of course, there will be some challenges. Some patients will be still in pain, they may be fatigued, or they may have had weakness for a long time, as Sunita mentioned. And this especially for in liver transplant recipients, they may have had encephalopathy before transplant, and this may be carried over after transplant. But if you can overcome these barriers, I think it's great, and you can start moving as soon as possible. So what happens after you go home? So your road to recovery should continue, because exercise is the key to your recovery and health. So the overall goal of exercise after transplant is to help transplant recipients regain function and return to work as well as to their family and societal roles. And some specific goals are to increase general mobility, as I mentioned, and this is especially early post-transplant, improve fitness, improve muscle strength, improve quality of life, and improve cardiovascular health. So what is the evidence for exercise after transplant? We are both researchers, so we love to talk about evidence and what the research tells us. So here, there is high quality of evidence that exercise training improves fitness, reduces blood pressure, improves muscle strength, improves quality of life in kidney, liver, lung, and heart recipients. So we have better quality of evidence for the phase post-transplant compared to the phase pre-transplant. And these are the recommendations that we had in the position statement. So now that I have had my transplant, how soon can I get back to exercising? So the first 6 months, we recommend that you participate in a supervised program as an outpatient or at home. Here, there are more studies showing that exercising at home, it's safe and is also beneficial. After 6 months, you have to choose a variety of, or you can choose a variety of or different programs that you like, try to combine cardio with strength training. And here it's very small, but we recommend that you try to achieve a moderate to vigorous intensity during your training, and that you do the exercise 3 to 5 times a week. And for those who don't know exactly what is moderate to vigorous, it's not that easy to understand. But if you, when you're doing moderate intensity exercise, it's when you sweat a little and breathe harder, but you're still able to talk to someone beside you. But you notice that you are breathing a little bit harder. And when you do vigorous intensity exercise, it's when you sweat quite a lot and you are out of breath. So you can't really carry on in a conversation or sing while you're doing the exercise. So you can have these things in mind when you're doing your exercise to try to see how intense you're doing the exercise. And here also it's important to know that in this phase, maybe the follow-ups with the hospital may have ended, or you don't have any contact with a physiotherapist anymore. So you are on your own, and you should be able to take charge of your life and plan to be active and do some more physical activity. So what can you do during your day-to-day life in terms of physical activity? So there are no specific Canadian or any physical activity guidelines for donors or transplant candidates and recipients. We have the Canadian Physical Activity Guidelines that was developed by the Canadian Society for Exercise Physiology. And these are the recommendations that they have for adults. So to achieve health benefits, adults aged 18 to 64 years should accumulate at least 150 minutes of moderate to vigorous intensity. Now you know what this means. Aerobic physical activity per week. You can do this in bouts of 10 minutes or more. They also recommend that you add muscle and bone strengthening activities using major muscle groups at least 2 days per week. And they say that the more physical activity you have, the better it is. You get more health benefits. They also have physical guidelines for older adults. So if you're older than 65, you should follow those guidelines here. Basically, it's the same recommendation. So to accumulate 150 minutes of moderate to vigorous intensity aerobic physical activity per week. Also add 2 days a week of muscle strengthening exercise, but they added some balance exercise for those with poor mobility, so we can prevent falls. And this is a very important issue in older adults. And again, they remind everybody that more physical activity provides greater health benefits. These guidelines also give you some ideas of what type of activities you can do. So they say pick a time, pick a place, and make a plan and move more. So I'm just going to go through some of the activities here. For adults, for example, they say join a weekday community running or walking group. Go for a brisk walk around the block after dinner. Take a dance class after work. Bike or walk to work every day. Rake the lawn and then offer to do the same for your neighbor. Train for or participate in a run or walk for charity. Take up a favorite sport again or try a new sport, and be active with the family on the weekend. So try to do some sports or some walking together. And they also have some suggestions for older adults. Okay, so we talked a lot about physical activity, exercise, go out there and start getting more active, but we are in the middle of a pandemic. So Canadians are being asked to practice social physical distancing to decrease the spread of COVID-19 in the community. So how can we adhere to a healthy, active lifestyle while respecting physical distancing measures? And there are some tips for you here. So of course, large groups activities are discouraged or even prohibited in some provinces or regions. You should be able to be active outdoors while respecting physical distance and good hygiene. So you can stay 2 meters when passing other people, try to cough into elbows and wash your hands when you go back inside. You can walk around the block, use driveways or backyards if you don't want to have contact with too many people. Sidewalks, cul-de-sacs, try to go to parks that are open during off-peak times, of course, to avoid crowds. In the winter, sometimes things can become a little bit more challenging. I love to do things outside, but I have to confess that here in Montreal, it's a little bit difficult to go for a walk or run outside because there's too much ice on the road, so it's dangerous. So if you want to do things indoors, if you have a stationary bike or treadmill, that's great. You could use them, or you can choose to walk in a shopping mall off-peak times, of course, wearing a mask if they are open. You can also go swimming in your local pool. Here in Montreal, the pools are open. I'm not sure about Ontario, but I think so as well. You can go skating at your local arena. They are all following COVID-19 safety measures. At home, you can do a lot of exercise. You can do body weight exercise. You can do wall push-ups, or you can find things around the house to lift, for example, food cans, laundry baskets. You can do squats. That is a type of strengthening exercise using your body weight. And even to do some aerobics exercise, if you don't have stationary bike or treadmill, you can choose to walk or jog on spot. It's not very, very fun, but for some minutes, I think you can do it and it will be beneficial. If you're more adventurous, you can go outdoors and you can go snowshoeing or skiing if the hills are going to be open. But snowshoeing, cross-country skiing, I think are two winter sports that are promising during this pandemic. There are some more ideas for you. You can always join Facebook, WhatsApp, Instagram groups, YouTube channels. There are many people giving classes, yoga classes, dance or workouts. You can join video call with friends. There are some free apps that you can sign up to keep you motivated. This one here, it's called LFit, and it's an app that has been specifically developed for liver transplant recipients. It is from University of Pittsburgh. I think it's free. So you can check that one. There are apps for yoga or 7-minute workout. You can check those as well. The Can Restore website, there you can find some resources as well. There are a couple of videos, I think 3 or 4 videos, maybe on examples of exercise that you can be doing at home. And remember, so we talked about the guidelines, and some people may get a little bit scared about the 150 minutes per week, especially if you have not been active for a long time. So remember that those daily recommendations, you don't have to do it in a single bout. So you can break the activities during the day. And you can do this alone or with a partner or kids, grandchildren. I'm not sure at this point if it's allowed in your region to meet people, but you can do this virtual if you want. So another thing that you have to remember is don't forget the other lifestyle behaviors. Try to have a consistent bedtime routine, sufficient sleep duration, balanced meals, avoid long periods of sedentary, so avoid long periods of sitting. Those behaviors will actually make you be more energetic to do exercise. And remember that during these uncertain times, we do have control over our behaviors. Again, you don't need to follow. If you haven't exercised for a long time, you don't need to meet the 150 minutes per week, moderate to intense exercise right away. You can start slowly with some simple exercise. So to start our presentation, we just want to give you some tips to keep you motivated. So set a goal. Again, if you haven't exercised for a long time, do not try to be too ambitious. Try to be realistic. Start with simple physical activities, exercise for a short period of time, and you can progress them gradually. Make it fun for you. Choose a type of exercise that you like to do. For me, what works is to choose different things. I don't like swimming every 5 days a week, but I love swimming. So I go once a week. Then I go skating and I do the 7-minute workout using my app. In the morning, I do yoga. So I try to do things that I enjoy. And for me, with a family, I like to do it different time of the day, but you can choose the time that it's good for you. Try to reach out to others for support. And this means that you can meet friends virtually now, or depending on where you are, you can go for a walk outside with a friend. Or it can also mean that you can reach out professionals like kinesiologists or physiotherapists. They can give you some, if you can afford, they can give you some good advice on what to do and how to progress your exercise. You don't need to have a weekly meeting. You can meet, they can give you some a plan, and you can do exercise on your own, and then you can meet this person again after a month, for example. Another thing that is very important is track your progress, because you will be happy to see your progress. It will give you more motivation because you will be proud of yourself. You will see, oh, you know, I've been doing something. And remember, something is better than nothing. And the more activity you do, the more benefits you have. So track your progress. Again, be realistic. And I hope you guys get inspired after this presentation. So now Sunita and I